Hey everyone, welcome to a deep dive all about diabetes.
Yep. We're going to be focusing on how it's diagnosed and the different ways it's classified these days.
Maybe you're prepping for some big meeting, or maybe it's something personal, or maybe you're just curious. Whatever the reason, you want to get up to speed, and we're here to help with the latest.
Right, and we're going straight to the source for this one. The American Diabetes Association's 2025 Standards of Care in Diabetes.
Ooh, yeah, that one.
It's a pretty hefty document, but that's where we come in, right? We've gone through it all and pulled out the good stuff.
The most interesting and relevant stuff for you. So before we get into all the details, let's make sure we're all on the same page here. What exactly is diabetes? We hear about blood sugar all the time, but there's got to be more to it than that, right?
Absolutely. Diabetes is a metabolic disorder. Basically, it means your body isn't using glucose properly.
Okay, so glucose, that's the sugar our bodies use for energy.
Exactly. And here's the interesting thing. The document actually uses a really interesting comparison. With diabetes, the glucose is both underutilized by the body and overproduced.
Oh, wow. A double whammy.
Yeah, double whammy.
So it's not just that your body isn't using the fuel efficiently, it's also like flooding the engine with more fuel than it can handle.
Perfect analogy.
Yeah.
And that's why understanding how we diagnose diabetes is so important.
All right, so let's talk about that. How do doctors actually figure out if someone has diabetes? What tests are they running?
Well, there are a few key tests. I'm sure you've heard of the A1C test,
Yeah.
but there are also a few types of glucose tests that doctors use.
Okay, so you've got the A1C, and what were the other ones again?
So there's the fasting plasma glucose, or FPG, the 2-hour plasma glucose, that one's also called the 2-HPG, and that one's done as part of an oral glucose tolerance test, or OGTT for short. And finally, a random glucose test.
Wow, that's a lot of tests. Random glucose test. That one's pretty self-explanatory.
Yeah, pretty much.
Good. Okay, so with A1C, we're looking at the average blood sugar over a period of time, right?
Yeah, the A1C test gives us a snapshot of your average blood glucose levels over the past 2 to 3 months.
So it's like looking at your bank statements over a few months. It shows you your overall spending habits rather than just one purchase.
Exactly. And if that A1C is 6.5% or higher, that's a red flag for diabetes. But it's important to remember that there are situations where A1C might not be as reliable.
Oh, interesting. Like what?
Well, for example, during pregnancy, or if you have certain blood conditions, the A1C might not accurately reflect your blood sugar levels. In those cases, glucose tests are usually preferred.
So the glucose tests are more like checking your wallet at a specific moment in time, like right before you make a big purchase.
Exactly. Each one looks at your blood sugar level at a specific point. So if the A1C is like your monthly bank statement, then the FPG is like checking your wallet first thing in the morning before you've spent anything.
Gotcha.
You fast for at least 8 hours before that one, by the way.
All right, you have to fast for that FPG test
Oh, great.
to get that baseline reading.
Right.
What about those other glucose tests?
Yeah, so for the 2-HPG, you drink a sugary drink, and then they test your blood glucose 2 hours later. It helps to see how your body handles a sugar rush. And then that random glucose test, well, that one's done whenever, no fasting needed. So that one's good for emergencies and things like that.
Okay, so if one of those tests comes back high, does that automatically mean you have diabetes?
Not necessarily. The ADA guidelines emphasize that diagnosis usually requires confirmation with 2 abnormal test results.
Is it the 2 strikes you're out kind of thing?
Yeah.
Just to make sure it wasn't a fluke or an error or something.
Exactly. And that's smart because they even mention the possibility of errors during testing, like something going wrong in the lab.
That's reassuring to know. Sometimes it's not you, it's the equipment. Okay, so let's say the diagnosis is confirmed. Everyone's heard of type 1 and type 2 diabetes.
Yeah.
But I'm guessing there are more types than that.
You're right. There are actually several distinct categories of diabetes, and getting the classification right is really crucial for tailoring the treatment.
Okay, this is where it gets interesting.
Yeah.
Hit us with the different types.
Yeah.
What else is out there?
Well, besides type 1 and type 2, there's gestational diabetes. That one develops during pregnancy. There's also monogenic diabetes. That one's caused by a single gene mutation. And then there's pancreatic diabetes. That one's connected to diseases of the pancreas. And even post-transplantation diabetes, which can happen after someone has an organ transplant.
Wow. I had no idea there were so many.
Yeah.
That classification system seems pretty complex.
Right.
Is there a risk of over-categorizing diabetes? Or is it truly essential to have all these distinctions for effective treatment?
It's definitely not about over-categorizing. Each type has its own unique characteristics and requires a specific approach to management. Take type 1 diabetes, for example. It's an autoimmune disease where your body actually attacks the cells that produce insulin.
So your own immune system is working against you. That's pretty intense.
It is. And then you have type 2 diabetes, which is more about insulin resistance.
So in that case,
Yeah.
your body is producing insulin. But it's like the key doesn't fit the lock anymore. The cells aren't responding to it properly.
That's a great way to put it. And over time, people with type 2 diabetes often experience a decline in insulin production as well.
So it's a double whammy. The cells aren't listening to the insulin. And there's less and less of it being made. No wonder type 2 can be so challenging to manage.
Exactly. And then there's gestational diabetes, which is unique because it develops during pregnancy and usually resolves after delivery. But it does increase the risk of developing type 2 diabetes later in life for the mother.
So it's kind of like a temporary diabetes, but with some long-term implications.
Yeah, you could say that.
That's fascinating.
Yeah.
And what about that monogenic diabetes you mentioned? The one caused by a single gene?
Right. Monogenic diabetes is much rarer than type 1 or type 2, but it's really important to identify because the treatment can be very different.
So one tiny gene can trigger all of this. That's wild. What are some examples of monogenic diabetes?
There's neonatal diabetes, which is present at birth, and MODY, which stands for maturity onset diabetes of the young.
So even if you don't have those classic risk factors we usually hear about, this one gene can still be the culprit. That's a game changer in terms of how we think about diabetes.
Absolutely. And here's a key takeaway. Knowing it's monogenic allows for more personalized treatment. And MOD, it helps identify family members who might be at risk.
That's incredibly valuable information for families. Okay, we've covered a lot of ground here. We've talked about the different tests used to diagnose diabetes, and now we're starting to see just how diverse this condition really is. But before we go too much further, I want to make sure I've got this straight. So far, we've talked about type 1, type 2, gestational, and monogenic diabetes, right?
That's
And each one has its own unique set of causes and challenges and treatment approaches. It's amazing how much we're learning about diabetes these days. It's not just one simple condition. It's a whole spectrum of different subtypes.
with their own complexities.
Exactly.
Yeah.
And that's why this deep dive into the ADA's standards of care is so valuable. It helps us understand the nuances and make sure we're approaching diagnosis and treatment in the most informed way possible.
I couldn't agree more. So what other fascinating types of diabetes are we going to explore? I'm ready to delve deeper into this world.
Well, next up we have pancreatic diabetes. This is a type that's often misdiagnosed as type 2. It's directly related to diseases of the pancreas that disrupt insulin production.
So pancreatic diabetes is all about a damaged pancreas struggling to make enough insulin, right?
Yeah, that's the gist of it.
Right.
If the pancreas is compromised, it can't produce enough insulin to regulate blood sugar effectively.
Makes sense. So can you give us an example of a condition that might lead to pancreatic diabetes? Sure. Cystic fibrosis, for instance. That can damage the pancreas and lead to what we call cystic fibrosis-related diabetes, or CFRD.
CFRD.
Yeah.
So it's like a domino effect. One health issue triggers another. Are there any other types of diabetes that come about from like specific situations or conditions?
Yeah, there's post-transplantation diabetes mellitus,
Yeah.
or PTDM for short.
PGM.
Yep. This type can develop after an organ transplant, and it's often linked to those immunosuppressant drugs
Mhm.
that people need to take to prevent organ rejection.
Wow. It's like this reminder that even life-saving treatments
Mm-hmm.
can have these unexpected consequences. It really highlights how complex the body is.
Yeah.
And how everything is interconnected. You know, earlier we were talking about type 1 and type 2 diabetes, the ones everyone's heard of. But you mentioned that there's more to them than meets the eye. Can you elaborate on that a little bit?
Absolutely. That old notion that type 1 is a childhood disease and type 2 only affects adults, that's just not true anymore. Both can occur at any age.
Really?
Yeah.
So you could have a child diagnosed with type 2 and an adult diagnosed with type 1.
Exactly. It's less common, but it definitely happens. And it can make diagnosis tricky, especially in adults who might be initially misdiagnosed with type 2 when they actually have type 1.
That sounds like a pretty big problem.
Yeah.
What are some clues that might point to a type 1 diagnosis in an adult, even if they seem to have the typical risk factors for type 2?
Well, there are a few key indicators. For instance, if they're diagnosed at a younger age, have a lower BMI, experience unintentional weight loss, or develop ketoacidosis, which is a serious complication of diabetes. Those could all be red flags for type 1.
So even if someone seems like they fit the type 2 profile, it's important to consider type 1 as a possibility.
Absolutely. Accurate diagnosis is crucial for getting the right treatment. And there's actually a handy mnemonic that doctors use to help with this. AABCC.
AABCC.
Yep,
That's quite a mouthful.
it is.
What does it stand for?
Stands for age, autoimmunity, body habitus, background, control, and comorbidities.
Okay, so age we've already discussed. It's not as clear-cut as we once thought. What about autoimmunity?
Right, so that refers to whether the person or their family has a history of autoimmune diseases. Since type 1 is an autoimmune condition, this is a crucial factor.
Makes sense. Then you have body habitus, which basically means looking at their BMI, because the lower BMI is more typical in type 1.
Exactly.
And what about background?
Background simply means family history. So if there's a family history of type 1 diabetes, that increases the likelihood.
Okay. Control, I'm guessing, refers to how well their blood sugar is managed.
Right. If someone is having a lot of difficulty achieving good blood sugar control. With non-insulin therapies, that could be another sign pointing towards type 1.
Interesting. So it's not just about their initial presentation, but also how they respond to treatment. And finally, comorbidities.
Yeah. Comorbidities are any other health conditions the person has that might be related to diabetes.
Gotcha. That AEBVCC mnemonic is really helpful. Thanks for breaking that down for us.
Yeah.
It really seems like getting the diagnosis right is essential for effective treatment. All right, so let's shift gears a little bit and dive a bit deeper into the specifics of type 1 diabetes. We know it's an autoimmune attack, but what's actually happening in the body at a cellular level?
Well, as we've discussed, the immune system mistakenly attacks and destroys the insulin-producing beta cells in the pancreas. And there are actually 3 distinct stages of type 1 diabetes that researchers have identified.
3 stages.
Yep.
Tell me more.
Okay, so stage 1 is characterized by the presence of autoantibodies. Even though blood sugar levels are still normal, it's like the canary in the coal mine, a warning sign that something's not quite right.
So even before the full-blown disease develops, there are signs that the body is starting to turn against itself.
Exactly, and this is why screening for those autoantibodies can be so important, especially for individuals with a family history of type 1 diabetes.
It seems like early detection is key here. What happens in stage 2?
In stage 2, those autoantibodies are still present, and now the person starts to show signs of abnormal blood sugar levels, but they don't quite meet the criteria for a diabetes diagnosis yet.
So it's like a yellow traffic light, a warning sign to take action before it turns red. What kind of action can be taken at this stage?
Well, at this point, the risk of developing full-blown diabetes is significantly higher. Lifestyle interventions such as healthy eating and exercise can play a role in delaying or even preventing progression.
Yeah, so there's still a chance to intervene and potentially change the course of the disease. That's encouraging to hear. What about stage 3?
Stage 3 is when the full criteria for type 1 diabetes are met. The person now has overt hyperglycemia and often experiences noticeable symptoms.
So this is when the disease is in full swing and treatment becomes essential. This stage-based understanding of type 1 is really helpful. Now, besides family history, are there any other risk factors that might increase someone's susceptibility to this autoimmune attack?
Well, there are some genetic predispositions, and researchers are still working to pinpoint specific environmental triggers.
So it's a combination of nature and nurture, as with many complex diseases.
Exactly, and here's something quite surprising. A new and unexpected cause of type 1 diabetes has emerged in recent years: immunotherapy drugs used for cancer treatment.
Really? That's unexpected. What kind of drugs are we talking about?
Specifically checkpoint inhibitors, which are a type of immunotherapy that helps the immune system fight cancer more effectively. But unfortunately, in some cases, these drugs can trigger an autoimmune response that attacks the pancreas.
So while we're making incredible strides in treating one disease, we might inadvertently be increasing the risk of another. That's a sobering reminder of the complexity of medicine.
It certainly highlights the importance of ongoing research, careful monitoring of new treatments, and a holistic approach to patient care.
Well said. Okay, let's switch gears again and delve into type 2 diabetes. We talked about insulin resistance and declining insulin production, but what are some of the underlying mechanisms at play there? It seems like a much more complex picture than type 1.
You're right, it is a complex interplay of factors. While researchers are still unraveling all the details, we know that genetics, epigenetics, inflammation, and metabolic stress all contribute to the development of type 2.
Epigenetics. Now, there's a term I haven't heard in a while. Remind me what that means again.
Okay, so think of it this way. You have your DNA, that's like the hardware, contains your genetic code. And then you have epigenetics, which is like the software, controlling how those genes are expressed. Epigenetics is all about how environmental factors can switch genes on or off. affecting how your body functions.
Okay, that's a helpful analogy. So in type 2 diabetes, could certain genes related to insulin production and sensitivity be turned down or even switch off entirely due to these epigenetic changes?
That's exactly what we're seeing. And these epigenetic changes can be influenced by various factors, including diet, exercise, and even exposure to certain toxins.
So our lifestyle choices might not just affect our health directly, but they can also influence how our genes behave. That's pretty powerful.
It is. It really highlights the interconnectedness of our genes, our environment, and our overall health.
That's right. You mentioned inflammation earlier. What's the connection there?
Chronic inflammation appears to be a key driver of insulin resistance. When your body is in a constant state of inflammation, it interferes with insulin's ability to do its job effectively.
So it's not just about the quantity of insulin you have, but also how well it's functioning in the presence of inflammation.
Exactly. You could have plenty of insulin, but if inflammation is blocking its signals, it won't be able to help glucose enter the cells properly.
It's like having a key that's slightly bent out of shape. It might fit in the lock, but it won't turn smoothly. What about this metabolic stress you mentioned? What exactly does that entail?
Metabolic stress refers to any kind of strain on your body's metabolic processes. Think of things like excess weight, high blood sugar levels, and even the accumulation of certain types of fat.
It's like pushing your body to its limits for too long. And eventually something has to give.
That's a great way to put it. And over time, this chronic stress can contribute to the epigenetic changes in inflammation we discussed, ultimately setting the stage for type 2 diabetes.
Wow. It sounds like type 2 is this really intricate web of interconnected factors,
Yeah.
all influencing each other. Are there any other aspects of type 2 that we should touch upon?
Yeah, there's the concept of prediabetes, which is incredibly important to understand.
Prediabetes. Is
Yeah.
that like a stepping stone to type 2 diabetes?
Yeah.
A warning sign that things are headed in the wrong direction?
You could say that. Prediabetes is a state where your blood sugar levels are higher than normal, but not yet high enough for a type 2 diagnosis. Think of it as being in the yellow zone. You're not in the red zone yet, but you're getting closer.
And what's tricky about prediabetes, if I remember correctly, is that it often doesn't have any noticeable symptoms, so you might not even know you have it until it progresses to full-blown diabetes.
Exactly. That's why screening is so crucial, especially for those with risk factors like obesity, family history of diabetes, and certain ethnicities.
So it's a chance to catch it early and potentially prevent it from developing into type 2 diabetes. What can people do if they're diagnosed with prediabetes?
That's the good news. Lifestyle interventions such as losing weight, getting regular exercise, and adopting a healthier diet can be very effective in preventing or delaying the progression to type 2 diabetes.
So it's not a guarantee that you'll develop type 2. There's still hope and a lot you can do to turn things around.
Absolutely. Prediabetes is a wake-up call, a chance to make positive changes, and regain control of your metabolic health.
That's really empowering to hear. Okay, we've covered a lot of ground on diabetes diagnosis and classification, from the various tests to the intricate details of type 1 and type 2 diabetes. It's been fascinating to delve into these complexities and understand just how diverse this condition really is.
I agree. It's been a journey of uncovering the many layers of diabetes. And remember, we're just scratching the surface here. The ADA's Standards of Care document goes into much greater depth on all these topics.
Right, this is just a taste of what's out there. You know, one thing that particularly stood out to me in the ADA document was the discussion of pancreatic diabetes, which we touched on earlier. They emphasize the importance of screening for this type after someone has an episode of pancreatitis. Can you elaborate on that connection?
Sure. Pancreatitis, which is inflammation of the pancreas, can damage those insulin-producing cells, potentially leading to diabetes.
So even a temporary inflammation can have lasting consequences for insulin production.
That's right. And the ADA recommends that anyone who has experienced an episode of acute pancreatitis should be screened for diabetes within 3 to 6 months, and then annually after that.
That makes sense. What about individuals with chronic pancreatitis? Do they need to be screened as well?
Absolutely. The recommendation is to screen them for diabetes annually.
So if you or someone you know has a history of pancreatitis, it's crucial to discuss diabetes screening with their doctor. It could be a game changer in terms of protecting their long-term health.
I couldn't agree more. Early detection and intervention are key in managing diabetes and preventing complications. Speaking of which, we've been discussing a lot about different types of diabetes, but there's one we haven't really delved into yet: gestational diabetes.
Oh, right. Gestational diabetes, the one that develops during pregnancy. It's fascinating because it's temporary, yet has potential long-term implications for both mother and child. Are you ready to unpack that one?
Absolutely. It's a topic that deserves its own deep dive.
Okay, so gestational diabetes.
Yeah,
It's a form of diabetes that specifically pops up during pregnancy, right?
right.
But then usually goes away after the baby is born.
Yeah, that's the general idea. Though, as we'll discuss, there can be lasting impacts. It's basically a type of glucose intolerance that shows up during pregnancy.
Glucose intolerance. So the body's struggling to process sugar effectively. Is that because of like the extra demands of pregnancy?
That's a big part of it, yeah. The hormonal shifts and metabolic changes during pregnancy put a lot of stress on the body. Sometimes it just can't keep up with the increased need for insulin.
And that's what leads to those higher blood sugar levels. We see in gestational diabetes, we touched on this earlier. But what are the real risks here? What can happen if gestational diabetes isn't managed well?
Well, there are risks for both the mother and the baby. For the mother, it significantly increases her risk of developing type 2 diabetes later in life.
So it's almost like a warning sign, a glimpse into potential future health challenges.
Yeah, you could think of it that way, but it's not just a future risk. Gestational diabetes can also cause complications during the pregnancy itself.
Like what kind of complications?
Well, things like preeclampsia, which is dangerously high blood pressure during pregnancy, and having a larger baby, which can make delivery more challenging.
And for the baby. What are the potential risks of gestational diabetes?
Babies born to mothers with gestational diabetes have a higher risk of various issues. They're more likely to have low blood sugar right after birth, breathing problems, and jaundice. And in the long term, they face a higher risk of obesity and developing type 2 diabetes themselves.
Wow, so the effects can really cascade down through generations. That's a powerful reminder of how important it is to manage this condition carefully for both mom and baby. So how is gestational diabetes diagnosed? Are we using those same A1C and glucose tests we talked about earlier?
The approach is a bit different for gestational diabetes. It usually involves a screening test called an oral glucose tolerance test, or OGTT. This is typically done between 24 and 28 weeks of pregnancy.
So instead of relying on just like routine blood work, there's a specific window for screening during the pregnancy. That makes sense. You know, the ADA document really delves into all the subtleties of gestational diabetes. One thing that caught my eye was the discussion of early screening, even before that 24 to 28 week mark. Why is that becoming more important these days?
That's a really good point. Traditionally, gestational diabetes screening happened later in pregnancy, as you said. But there's a growing body of evidence suggesting that earlier screening can be incredibly beneficial.
Interesting. I'm curious what's driving this shift toward earlier screening.
Well, it turns out that a significant number of gestational diabetes cases are actually undiagnosed type 2 diabetes that existed before the pregnancy.
Oh, wow. So not gestational diabetes per se, but an underlying condition that's being unmasked by the pregnancy.
Exactly. And by screening, early doctors can identify these cases much sooner and get the mother the treatment she needs right away, which leads to better outcomes for both her and the baby.
That makes a lot of sense. It's about being proactive rather than reactive.
Yeah.
Are there specific recommendations for who should be screened early in pregnancy?
Yeah, the ADA guidelines now recommend that anyone with risk factors for diabetes, such as obesity, a family history of diabetes, or belonging to certain ethnic groups, should be screened for undiagnosed diabetes at their very first prenatal visit.
So it's a targeted approach based on individual risk factors. What about those who don't have those obvious risk factors?
Even then, the ADA suggests that testing for undiagnosed diabetes before 24 weeks should be considered.
So there's a real push to move away from the wait-and-see approach to a more proactive early detection strategy.
Absolutely. And it's not just about finding pre-existing diabetes either. Early screening can also pick up on what's called early abnormal glucose metabolism.
Early abnormal glucose metabolism. What is that?
It's basically a state where blood sugar levels are higher than normal, but not yet meeting the criteria for a diabetes diagnosis.
Okay, so it's like that yellow flag, a signal that things might be heading in the wrong direction. But there's still time to course correct. What can be done if someone shows signs of this early abnormal glucose metabolism?
Well, that's where lifestyle changes become super important. Things like diet modification, exercise, and even stress management can potentially prevent progression to gestational diabetes.
So even if you don't have full-blown diabetes, those healthy habits can make a big difference in pregnancy and beyond.
Absolutely. It's all about empowering women to take control of their metabolic health and giving them the tools to have a healthy pregnancy.
Well, this has been an incredibly enlightening deep dive into the world of diabetes. We've covered so much ground today, from the basic tests used to diagnose diabetes to the nuances of all the different types and the importance of personalized treatment.
I agree. It's amazing how much we've learned about diabetes in recent years. And it's clear that the ADA's Standards of Care document is a treasure trove of invaluable information.
It really is. And for our listener, remember this was just a glimpse into the vast knowledge contained within those guidelines. If you're eager to learn more, I highly encourage you to check out the full document. We'll include a link in the show notes.
And of course, always consult with your healthcare provider for personalized guidance and treatment plans.
Couldn't agree more. Well, thanks for joining us on this fascinating deep dive into the world of diabetes. We'll be back soon with another deep dive into a new and exciting topic. So stay tuned.